I am Daniel Ortega from Buenos Aires, Argentina. Thank you for the invitation. I'd like to share with you a new treatment for Brugada syndrome. It really is a case report with basis in a Synchrony evaluation. We are working with the Para-Hisian patient for many years. We prefer this approach, crossing normal usual catheters through the tricuspid pole and pacing in this zone. Then some groups call it non-selective cis-bundle pacing. Selective cis-bundle pacing we don't use. Really a method to measure the electrical synchrony was described in two papers. This is for bioengineering, and another is for clinical. Really the method is very simple. We overimpose two leads, T2 and V6, and after the processing of signal ablation, we obtain two curves with different index showing the electrical synchrony. This is a screen with the ECG or surface, where this patient have a little bundle branch block with the end of the deflection here delayed, with the electrical index, heart rate, and these curves overimposed in a normal patient. And of course, you can measure automatically the duration of the QRS. After studying more than 6,000 patients, we obtained this chart with a different degree of this synchrony. In green is the synchronous, yellow intermediate, and red is synchronous. But I like to pay attention, in this case, this is a normal patient with overimposed curves on the low index, and when you pace in the Para-Hisian area, the QRS is wider, but is overimposed and synchronous. We presented in Munich 2 years ago. Our experience was more than 300 patients pacing with guided by this method. We use a pacemaker, but we implant also ICD catheters, common ICD catheters. With this method, really the index of displacement is very low, good threshold, and good R wave. Recently, we published this experience comparing selective versus non-selective cis-bundle patient. And this really this approach for us is safer, and really we place the catheter without special tools, but we are not against special tools or special catheters. In a patient with a right bundle branch block in this case, but wider, you can correct also the end force of the QRS. You can see in the ECG here the normalization of QRS. What happened in the Brugada syndrome? There is a consensus that the problem is in the right ventricular outflow tract. This is the arrhythmogenic area. Radio frequency ablation of this outflow tract sometimes it's successful, sometimes not, but everybody implant the ICD of the cat. The drugs are not successful, and the ICD is the only effective treatment. There is nothing to prevent shocks, and shocks are not frequent, but all are preceded by Brugada pattern. This is not in this case, pay attention in this case. And the pattern is intermittent. Para-Hisian stimulation in this case report is a 59 years old female patient with a family history of sudden cardiac death with multiple episodes of syncope. In 1220, the diagnosis of Brugada syndrome was made, and several shocks after the implantation of the ICD with ventricular arrhythmias. And in 2015, endocardial ablation was performed in other centers. After that, several episodes of syncope due to ventricular arrhythmia was registered and under treatment with quinine. The patient was admitted in our institution with electrical storm, with 5 episodes in 1 day. Addressed the ECG of type 1 of Brugada. The Synchrony measurement with Synchromax showed the delay at the end of the QRS with the deflection. According to our previous research, with upgrade suggested to the patient, and meanwhile the stimulation was programmed to 100 beats per minute. In order to improve the electrical synchrony, one catheter was implanted in the Para-Hisian area and another in the upgrade at the DDD in the right atrium. And with this patient, we confirm the absence of the delay at the end of QRS and normalization of the QRS. The patient was remaining asymptomatic for more than 5 years, but this patient was pacing constantly. This is a Synchromax curves with address with the delay at the end of QRS, and when we pace, we disappear this delay at the end of QRS, and the normalization of QRS is shown in the ECG. This is the X-ray showing the old catheter in the right ventricular apex, the new catheter in the Para-Hisian zone, and another catheter in the atrial position. As a conclusion, the Para-Hisian septal stimulation normalized QRS configuration and electrical dyssynchrony, and it is proposed as an alternative treatment to electrical storm in the Brugada syndrome. This patient, or some of the patients, really have intermittent pattern. We propose with this patient a new device to pace only when the pace is wider. This is all the case, and thank you for your attention.